Hi everybody, I'm Laurie Cadden, and we are here at the wonderful office of this beautiful woman right next to me. Her name is Mandy Doria, not the West Side Dorias, but the South Side Dorias Ellard, and she is a licensed professional counselor in private practice, and we are in her beautiful office. And also joining us today is Mr. John Kuna, who is a doctor, I should say, he's a psychologist, right?
Yes.
And he is in private practice as well, and we are here to talk a little bit about seasonal affective disorder, or SAD, right? That's a way to look at it. Now, we're not going to be sad during this, we're going to be happy. But we are here, so this is another one of the wonderful Lackawanna County Medical Society's public health education series. We're here to talk a little bit about that, how it happens, what it means, how you can get help for it, because let's face it, we have a lot of gloomy days. You and I, Mandy, spoke a little bit about is it the gloominess? Is it the lack of sun? Then, John, when you came in, we talked about it's not necessarily the sun or the light, because skiers who are putting goggles on and they're in sometime gloomy, it's the activity that maybe gives them the ability to not be affected by this type of disorder. So let's talk a little bit about what actually is SAD.
So I think you brought up a lot of good points, and there are very many questions about SAD in general. But the first thing I think we need to understand is that it is a form of clinical depression. So it doesn't just mean you have a bad day here or there, or you kind of get, a little bit down. We all sometimes get the winter blues. So what's the difference between getting the blues and actually having SAD? So it's something to consider. If it's something you've struggled with for about 2 years, that's more diagnosable versus something that you've had a bad week in the winter. And in order to be diagnosed with clinical depression, an episode usually lasts for about 2 weeks. And, there's an array of symptoms, but some of those symptoms, and you can chime in with me here, are just kind of feeling like a loss of pleasure in what you normally like to do, low energy, a change in sleep or appetite, a change in your ability to concentrate or focus. So those are some general symptoms of depression, thoughts of harming oneself or thoughts of suicide. So these symptoms can also overlap and be a part of SAD. And then there's also some distinguishing factors with SAD. So I don't know if you want to add on to that and what you kind of think about it.
SAD is one of the basic, what I call it SAD, is that it's sadness more days than not. And there's a hopelessness, there's a sadness, there may be a tearfulness for no reason. There could be lethargy where you can't get up and do things like you felt you used to. There could be a lack of pleasure in many things, and it is brought on by this time of year. It is seasonal affect. There's many different types of depression. There's major depression, there's endogenous depression, maybe after operations or car accidents. There's many different forms of depression, but SAD is brought on by this time of year. And we were talking earlier, many times there's holidays during the year where we do have lots of sweets and things to eat. You can go from Memorial Day to the 4th of July to Labor Day, but it's well spaced out and there's lots of activity, but not so much during this cold winter. There is darker days. You have Thanksgiving, then Christmas, then New Year's. There's nothing wrong with that. And you have lots of sweets. You have lots of food, and we tend to sit around. It's the perfect storm. It's the perfect storm. It just creates a general feeling of, we're not hibernating, like we're not small animals or bears, like we don't hibernate, but it creates a perfect storm psychologically, that we're just going to sit around and maybe eat too much, or maybe not feel good about ourselves, and maybe not make plans and not make goals, not go out. It's cold. We don't get out in the yard. We don't go out for walks. The next thing you know, we're suffering from a form of depression.
Is that, though, this particular disorder, is it, when it happens, how, because it's so close, a lot of what you're saying, so many of these symptoms are flat out depression. So how do you know then, because it only happens at a certain time of year, what actually is the way you pinpoint that this is that and not just a general depression? Can anyone answer that part? Because I think that would be, I guess it's time of year. Is that part of it?
Yeah, so you can have seasonal affective fall into the early winter, but you can also actually have a different form of it late spring into summer, where it's actually a little bit more agitated and more insomnia. But in the winter specifically, it's more common, and it has to do with the days getting shorter, right? And feeling like, well, there's a couple of different reasons why it's happening, and then I think that'll answer your question too. So melatonin is the hormone in the brain that is released in the darkness, right? It's what allows us to sleep. So when we have shorter days, there's less melatonin. So we're not, there's a decrease in melatonin. And so that is affecting our sleep rhythm, right? And then the lack of sunlight, which is emitting the vitamin D and emitting, actually helping serotonin levels, because decrease in sunlight can actually cause it's affecting the serotonin levels in the brain too. So when you have those changes in your brain and in your vitamin and neurotransmitter levels, it creates more of a propensity for the brain to be unable to adapt to that, and it can affect your circadian rhythm, which is why we want to sleep all the time.
Right.
So if you're coming home from work and you take a 2 or 3 hour nap, and that's really unlike you, chances are that wanting to sleep more, or you're sleeping 10, 11 hours versus 7, 8 hours, 9 hours, something might be off, right? And that's kind of when we look more for those indicators. Weight gain. I know you said it's common, right, to have a lot of...
You're not active, you're eating more.
Right.
Yeah.
And so that's when we get, I think, more into the specifics of what depression looks like. Are you not saying yes to plans? Are you not making plans? Do you not have as many interests in the winter that you get outside and do things like we were talking about? You're less likely to, lose interest if you are a winter sports person. For me, I do yoga, so I make sure I get to my classes in the winter, especially because it can release those healthy chemicals in the brain to fight the decrease in the decrease in the other levels, right?
So and I think this is a perfect segue. As I said earlier, John, you were saying that the activity in skiers. So now Mandy's saying the fact that she teaches dance and she teaches yoga, she goes to this. So this is already now your energy is increased. So that obviously is the key, or at least the link, I would say, to knowing that this is, if you're really like a couch potato, for as many people are, and sometimes I think to myself, oh my God, because I may not want to go somewhere and think it's freezing or it's icy. Oh my God,
I've gained a little weight from Thanksgiving and I don't want to go out.
That people think about that. You just get scared, like, oh, I hope that's not, but those are normal, because there's also a normal. And I say, like, we were thinking of Florida, my brother who lives in Florida, and I said, they never have a snow day down there. They never have a day where you can just say, we're canceling everything and everything's closed for the day. And in many ways, as much as I hate that, because I like a routine, there's some comfort in not having to do something and it is canceled. So that down day sort of gives you that little bit of comfort. That part of it that is normal, I guess, for anyone who's busy, when you get a day where you're backed off, it's like, okay, that's a good thing. Too much of feeling this is a good thing, of not doing, is a bad thing, right?
It's a bad thing.
Yeah. So what happens then, John, when somebody is clinically diagnosed as having seasonal affective disorder? What happens? Do they have to be on some type of antibiotic, I was going to say, antidepressant? Is it something they can move beyond? Or what is the way that that's best treated once you're diagnosed with this?
Medicine is always appropriate.
Okay.
And it may not be long-term, it just may be through the winter to get you into the spring and early summer. But medicine is always appropriate to help with depression, help the serotonin levels, and various mechanisms inside the brain. One of the best, we looked up several articles. We had some features done previously, and one was how to fight the winter blues, how to increase self-esteem, how to handle holiday stress. And between all of these articles, one thing came through, and I'm not even exaggerating, and it was stay active, exercise. Stay active and exercise. And I was talking to somebody the other day, and he said, well, I'm not going to exercise, John. He said, we shut down the upstairs, and it's cold up there, and the treadmill's upstairs, and we even have a door with insulation on it. We don't go up there, and try to think outside of the box, when it comes to exercise. And I said, well, how many stairs are there between yourself and the treadmill? He said, well, 12. But we don't go up there. We don't go up there during the winter. We're not bringing the treadmill down. We don't exercise during the winter. I said, well, how many stairs did you say? He said, 12. I said, well, can you run up those stairs and touch the door and come down? He said, do you have a handrail? Do you have a heart problem? He says, no, I don't have a heart problem. Yes, there's a very good handrail. I said, well, can you run up and down twice? Oh, sure, I guess I could. I didn't think of that. I just touched the door. Don't go in the room because it's cold. You help me understand. It's cold. So don't go inside the cold room where the cold treadmill is. Don't do that. But could you run up and down the stairs 4 times? Well, yeah, I guess I could. I never thought of that.
There you go.
And the idea was to think outside of the box to increase your activity. And that's a way to help fight seasonal affective disorder.
And am I correct then in saying that, as you said, in the time that it happens, when people aren't in that time frame and they're in the spring and it's, the days are getting longer and they're feeling more energized, are they completely out of it then for a while, like meaning out of the depression and then slowly seep back in? Or is it something, and is it just that time you need to be under some type of, or given some type of medication and then nothing, or is it a continual medication just to make sure you balance everything?
Well, I think that's definitely something you talk to your therapist and doctor about, with who's prescribing your medication, because it is really a case-by-case example. It's a great question, but there really is no easy answer to that because depression can be ongoing for some people and it worsens in the winter. If you're talking about, somebody who's only experiencing SAD, it is possible, like John said, to taper off of the medication once they start feeling better, right? And I think a big part of this, he gave a great example, is talking to a therapist, reaching out for help. So I think the bottom line is you know yourself best. If you feel like something is off, chances are something is off, right? And so acknowledging that within yourself and taking that step to reach out for help and know that help is available and that there are treatment methods for this, not only therapy and medication and exercise, but coping, like finding your own way to deal with these feelings and thoughts and difficulty with your energy. It's different for everybody, so it's really important to explore that. Light therapy is also an option that some doctors prescribe, where you can sit underneath a light that emits, I think it's like 10,000 times the amount that an inside light would, a light bulb would give you, and it sort of mimics the sunlight, so it helps a little bit of that serotonin production, and if people read under it for 20-30 minutes a day, that can help increase those serotonin levels. So there is no easy answer to that. I think medication, it's a different story for everybody, but it's an important thing to consider if you're really struggling, especially with feelings of hopelessness, worthlessness, and suicidal thinking. What is even more interesting is you said when you start to feel better. Sometimes people don't feel better, and this is why spring is actually the highest rate for suicides. Because most people are coming outside, they're starting their gardens, they're going for walks, they're starting to feel better, they're connecting with their family again. It's the people that are really struggling that are not doing those things and that are thinking, man, I really am depressed, and now it's more noticeable because it's not as common. And I could feel it more because all my friends are happy
you can't
again.
kind of hide at that point.
Yeah. So it's important to kind of just notice those signs and symptoms in yourself and in a friend or a family member.
And I also know too, is a little off the sad stuff, but the fact that I know that so many people who struggle with any form of depression, one of the biggest issues they have is when they stop taking their medicine, because the medicine now works, they feel better, they think that they're no longer depressed, and then they stop taking the medicine. And that's probably, I would assume, something you should never do, because that is maintaining your chemical balance, and that's why you're feeling better, because you are taking it, not because you're miraculously somebody else. Does that happen a lot?
It does, yeah. And again, it's important to talk to your doctor and or therapist to appropriately appropriately make those decisions for what's healthy for you. Sometimes I like to think of medicine as like crutches or a cast, until you feel better, and then you could take it off. But like Dr. Kuna said, sometimes it's something that at a low dose of something people may take on and off throughout their whole life or for long term, and that's okay.
Yeah.
If you were having a heart attack and you were prescribed heart medicine from your doctor, are you going to say, no, I think I'd rather risk the heart attack?
Exactly.
No, you're not going to say that, right? So if it's appropriate to stay on it, I mean, it makes sense. I know you want to
John,
add something.
do you find, too, the stigma that's attached to any form of mental illness, be it depression or anything, that there's such, and that's similar, the reason I said that is because someone who has a heart issue is going to take medicine, and they're not going to be afraid to say, I had a heart issue, I have a heart problem, and I need medication. But so many people are fearful to say that they have an issue that is a mental health issue and that they're taking meds to help combat what's going on. Do you find that getting less, John, in your practice, or is it getting worse, stabilizing? What do you think is going on with that?
It's getting better.
Is it getting better?
It's getting better.
Because awareness, right?
Awareness.
Yeah.
People are understanding that mental health issues, whether it's depression or anxiety, are medical conditions. They're not because of stigma, because of the will, because you're not a strong person. You don't have diabetes because you're a slacker.
Right.
And you don't have multiple sclerosis because you just didn't take care of yourself. You brought it on. These are stigmas that people believe. It's like ways that people try to make explanations for medical conditions. But depression, anxiety, bipolar disorder, schizoaffective disorder, schizophrenia, they're medical conditions. And they might, like Mandy was saying, they might take medicine for a while. They might take medicine for life. They might take medicine for a long time. The point is that you have to manage your medical condition. If you're diabetic, you have to manage your diabetes. You can't say, well, I'm having a really good day today. It's a very sunny day, and so I really don't have to take my metformin today.
Right.
I don't feel like I have to. It's not a feeling thing. It's understanding that it's a medical condition and it may need treatment for an extended period of time.
Okay, and then on that, and either one, please feel free. Once obviously a diagnosis is made and they say this is, you have seasonal affective disorder, thank you. Once that happens, do most people, and when they realize what it is it that they then do? How do you help them beside medicine? How do you help them with ways that they can try to cope and make themselves feel better, or to make it less crazy for them to deal with all of these issues?
Yeah, evidence-based research points to cognitive behavioral therapy being really successful for things like SAD, among other kinds of diagnoses. So we really work with someone to identify the thought patterns, the behavior patterns that are affecting the way they're feeling, and trying to change that form of thinking, to be more realistic, be more positive, and to be more creative in finding a way to be active, like climbing the stairs a few times a day, or maybe making, a friend's night once every 2 weeks to kind of get them out of the house, just because, even if you don't feel like it, just say yes, once this week. So it really is, it could be motivational, it could be support. A lot of times it's just getting those thoughts and that burden off of your chest. So through talk therapy, just talking about what's going on, what's stressing you out, what's going on in your life, what are your goals in your life, and how can you reattach to those? How can you find a sense of meaning in the winter? I sometimes recommend books too. So there's a recent recommendation that my mother is actually reading.
Okay.
It's from an author in Denmark, and it's called The Cozy Life. And it talks about how to, if you're indoors, like especially on a snow day, you can't go anywhere, how can you set up the environment? What are activities you can do together to connect without electronics? Because the bottom line is we feel better when we're connected, right? And that can also increase hormones and the endorphins and the serotonin, just like exercise can. So there's a lot of things that we could talk about with what is healthy for that person. It depends on who it is. and what they need and what's important to them. So whether it's, having friends over and enjoying a movie and having some tea, or, going out to the movies. My goal this year was to see all the Oscar nominations, and I'm almost there. So,
because it's almost
and
there.
that gets me out of the house. Yeah, it's important to be creative and be open. And when you come to therapy, I think that does help open up your mind to different solutions. So,
Does one thing lead to the other with depression? Meaning this. If somebody starts at home or anywhere and they start feeling, say it's a bad winter and they can't get out and they're saying, hey, I kind of like this, that I'm not going. And then they start saying no instead of the opposite, and they're not realizing that they're in this type of depression, that they're thinking, does that build up to something, or is it something like we were talking earlier when we have all these other predisposed illnesses, like if you're a diabetic, or you said MS, or something that is in our genes, we have it. Does that happen here, or is it just part of your chemical makeup that it's going to happen, or can those type of behaviors lead to some form of depression?
Absolutely. I think SAD can definitely trigger a more chronic depression. Research does point to that. But like you said before, if someone in your family has suffered with mental illness, you are more likely to develop something like SAD too. So both, right?
Okay.
Did you want to add something? Anything?
It could be both.
Yeah.
And it depends on, we talked before, that there's many different types of depression. There's unipolar depression, major depression. And, could SAD morph into something? It might. You don't know. It might morph into a form of unipolar depression, but not likely. It's not likely. Unipolar depression is its own type of animal.
Okay.
Could SAD morph into some type of dysthymia? Something of a sadness that lasts maybe into spring or summer. It could definitely morph and stay and hang around a little too long if not treated appropriately.
But the best thing then, to all of you watching, is to understand what the symptoms are, what you're experiencing, and don't be afraid to look for help, and so many people do this type of help, as we're sitting here with two people here who do it and understand it, and that's the thing to do, is reach out and get professional help, talk to someone about it, even if they make an appointment and they come in and talk to you. Those are the things that will get, once you can kind of pinpoint what's going on, do something about it. And don't suffer, because that's the worst part.
Absolutely. Yeah. We were talking before a little bit about statistics. NAMI, that's our local organization.
Right.
The National Institute of Mental Health stated that 4 to 10% can suffer from SAD, and we were talking about distance from the equator. So Florida, there's 1% of people that struggle with it, versus Northeast New England states, 9%.
Yeah.
So 1 out of every 10 of your friends, could be struggling with this. So you're exactly right. Once you identify, this is something that I could be struggling with, even if you're not sure, it's still good. If something's wrong with your car, you're going to be like, that's a weird noise. Let me get it checked out.
Right.
And then, then we could figure it out from there. So get it checked out. There are dozens and dozens, if not hundreds, of great therapists in the area that I refer out to all of the time, and we work together pretty well to try to help our community and work together. It's really important to do that, and there's a lot of good resources. We have a lot of great community events, like First Fridays, like yoga studios that are offering meditation and yoga, like gyms that are offering, nice new memberships in the new year. So there's lots of options.
And so before we end, is there anything we missed or I didn't ask, or anything you want to make a point of telling our viewing audience beforehand?
Just that, when you come to counseling, it's not so bad, right? I mean, it pretty much looks like this.
Yes, it's very comfortable. Yes.
Very comfortable people.
Yeah, and it's just, it can lead to maybe some more growth and for you. So to not be afraid to reach out, and it doesn't mean you're weak, like John said. Yeah, that's what I would like to say.
And I would like to say, continue with my theme of looking outside the box for activities around the home. Continue to find different things. There's a behavioral health medicine technique called Premack's principle. And what does that mean? It means something unlikely before something very likely. And what would be a good example for behavioral health medicine would be you put clothes in the washer. Well, it's very likely you're going to take the clothing out of the washer and put it in the dryer. Well, go on a treadmill, because it's not likely you're going to go on the treadmill. But it is likely that you're going to take the clothing out of the washer. So go on the treadmill till the washer's done.
There you go.
Thinking outside the box.
Or walk up those stairs.
Walk up those stairs.
To get to the treadmill and back,
Yeah,
right?
put the clothing from the washer into the dryer, go back on the treadmill. When most dryers buzz or something like that. Now you've done something unlikely while doing something more than likely. So it's thinking outside the box a little bit.
I like it. One more thing I want to ask. What about supplements? Are they a good thing to take? Because I know people who take melatonin at night to am I saying that right? To go at night. So do they work or not?
So because there is a decrease in vitamin D with the shorter days and lack of sunlight, some people do try vitamin D supplements.
Okay.
It's hit or miss on whether that actually works. I think that's something, again, you could talk to your doctor about, might be something you incorporate to your daily vitamin regimen. But it's not the only answer, I would say. If you're doing that, you should definitely also, if it's that bad where you're considering supplements, I would also call your doctor and talk about it, because it's not going to fix it,
Yeah.
A lot of times we are looking for those quick fixes.
Right.
But yeah, I think it could be a little bit more complicated because we're talking about a clinical diagnosis. And so a supplement isn't really the only answer. I don't know too much about melatonin supplements, but I think, again, if you have an increase in light, if you can get outside, especially on those sunny days, and just sit toward the sun and get that light in, it really can make a difference. 10 minutes. I always take a walk out in the courthouse when it's sunny, even if it's 30 degrees, because it helps.
It is the sun, because yesterday it was so beautiful.
It was beautiful.
Cold, brisk, but the sun was out. It makes such a difference. Today was a little gloomy, and then all of a sudden I saw the sun coming out, and I said out loud, "Oh, get the sun out!" Like, that is the best feeling. So anytime you can see the sun, I think it works. So thank you.
Yeah, you're welcome.
So
Thank you.
thank you for your time. We appreciate it. Thank you, everybody, for listening. And see, it wasn't that bad, Mandy, was it? We coming in, we're like, are we all going to get it? And it all worked
We
out.
got it all in, I
There,
think.
we got some light
I
around
hope that
here
they
and-
learned something.
Yeah,
So
there we go.
enjoy it.
Well, thank you.
Have a great day.
So I'd like to thank everybody for watching. Again, please take what both John and Mandy are saying to heart. And if you feel that there's any issue you're having that doesn't seem like it's a usual thing, talk to somebody about it. Don't let it get ahead of you. Talk to someone and see what they can do to help. You'll always feel better when you talk to someone and they can guide you in the right direction. So we hope you'll do that. And we again thank you so much for listening. Again, this has been Lackawanna County Medical Society's Public Health Education Series. And my guests today are Dr. John Kuna and Mandy Doria, the Southside Doria Ellard. And we'd like to thank you again, because I can't thank you enough, for listening. I'll talk to you soon. I'm Laurie Cadden.